Thank you, Mr Speaker. My question is to the Associate Minister of Health and asks, does he agree with Dr Shane Retty when he said, "We are sending out a signal to people with myeloma and the people with leukemia that we understand and we haven't forgotten you"? And if so, what actions has he taken to deliver on that following receipt of the Cancer Control Agency's report titled Understanding Blood Cancer Medicine Availability in Aotearoa, New Zealand?
Mr Speaker.
The Honourable David Seymour.
In answer to the first part of the question, yes, absolutely. I happen to have known Dr Reddy for over 10 years. We're both from Whangarei, where in fact he worked with my mum, and he's one of the kindest and smartest people I know in politics, so I don't doubt for a moment his sincerity when he says that he is there to help people with cancer, as we all should be. In answer to the second part of the question, while the report's publication is relatively recent, this government has initially increased the budget for Pharmac over 4 years by $1.774 billion to fill in a fiscal hole left by the previous government when the member asking the question was the minister responsible. Subsequent to that, we've increased funding by a further $604 million. Now, it's not Dr Reddy's responsibility to choose which drugs to buy, or any politician for that matter, but what has happened, and I can tell you, when you go down to Pharmac and you hear from the people there, people work for Pharmac because they love buying medicines for Kiwis, and they are so busy funding new medicines for people with all manner of cancers, and I hope that soon they will fund more medicines for people with blood cancers.
Supplementary. Will he assure blood cancer patients that all 9 medicines identified in the report as offering significant clinical benefits but currently unfunded, or their equivalent, can be funded from the extra investment in Pharmac that he just cited?
Mr Speaker, the member knows very well, because she's had this job, that if a minister is able to ensure that a particular medicine will be funded, then Pharmac is not actually independent. Therefore, I can't stand here and say that Pharmac will fund a particular medicine, but what I can say is that they have never had more money to fund medicines in the history of this country. The amount of money that's going into it is exceptional, and it's already having its effects felt by people battling cancer up and down this country.
Cancer. Supplementary. Why didn't the government run a process that would have given these patients with blood cancer an equal shot at the funding to patients with solid tumours when, after all, Dr Shane Retty knew about this issue before the election?
Mr Speaker, that is precisely what the government has done. Pharmac do not discriminate. Their goal is to secure for eligible persons maximum medical benefit from the available funding that has been dramatically increased under this government. And let me just say it one more time for that member, in case she's forgotten anything or didn't know when she was the Minister of Health herself. The biggest difference that a Minister of Health, or a government, or a Minister of Finance, or a minister responsible for Pharmac can do is provide more money for the people at Pharmac to buy more medicines for Kiwis. And on that simple measure, it is not just 1-0, it's 1,000,000-0.
The Honourable Shane Retty.
Thank you.
Hang on.
Can the member confirm that up to 4 blood cancer medicines have recently been funded by Pharmac?
Mr Speaker, yes, I most certainly can, and that is an example of the decisions that Pharmac is making in order to ensure the money is put to the best possible use. It benefits people with solid tumours, it benefits people with blood cancers, but it also benefits people, for example, with type 1 diabetes, who now have continuous glucose monitors funded by the taxpayer through Pharmac. Right across the board, this government is improving the access to medicines at a level never before seen in this country.
Supplementary. In light of his previous answers, am I to take it that people with blood cancers do not have an assurance that their cancer medicines will be funded, but solid tumour patients do? Or do solid tumours also have no assurance that they will be funded under this initiative?
Mr. Speaker, I think it's fairly straightforward. This government is very clear that Pharmac makes the decisions about which medicines to fund. We make the decisions about how much funding they receive. And the member knows this. What the government has done is ensure, in line with...
Just stop there. We hear the rest of this in absolute silence.
Thank you, Mr. Speaker. This is a very serious matter for a lot of New Zealanders, as I'm sure nearly every member of this House who's known someone with cancer will know. As I was saying, what the government has done, in line with pre-election commitments, is provide funding that will allow a list of drugs or their equivalents to be funded. That commitment has been undertaken. From now on, we do everything we can to increase the amount of funding for Pharmac in order that more medicines can be bought. And for example, I'm happy to tell the House that I have asked Pharmac to be active and aggressive in showing how they, by funding more medicines, can save money right across all of society to boost the Pharmac budget even further than the current record levels, in order that more people with all types of ailments, including blood cancer, will have more chance of seeing their medicine funded sooner.
Supplementary, the Honourable Nicola Willis.
Can the Minister confirm that Pharmac's ability to deliver more cancer drugs to New Zealand cancer patients would have been made even harder if this government had allowed the time-limited shortfall in Pharmac funding, the fiscal cliff left by the previous government, to endure?
Mr. Speaker, I remember very well meeting with that minister, our Minister of Finance, and our meeting was scheduled to be about that shortfall. We knew that if we did nothing and carried on with the previous government's funding track, we would go from around $1.5 billion per year to about $1.1 billion per year. The advice I'd received from Pharmac was that Pharmac would first decide
everyone
that
seems to have forgotten we're listening to the rest of this question in silence.
Some medicines and some indications, they would have to stop new patients getting those medicines. If that didn't save enough money to make up for the previous government's forecast budgeted shortfall, then they would have to actually take people off medications. You know, someone thinks it's funny to heckle. I can tell that young member that actually medications for people and people losing their medications when they are often terminally ill is a very serious matter. If you wouldn't mind listening, that'd be helpful. Mr. Speaker, we recognised that Pharmac would actually stop people receiving medicines they were already prescribed. That was the advice. So Nicola Willis and I, our Finance Minister, looked at each other at the start of the meeting and we said, we've just got to do it. And that was basically the end of the meeting.
Supplementary.
Just wait for the silence that is going to be across the House to the duration of this question.
Has Shane Reti broken his promise to blood cancer patients that they will not be forgotten, when it is actually true that they are an afterthought in this policy?
Mr. Speaker, all I'm going to say to that is that there is a line in opposition politics between advocating and exploiting somebody, and I think what that member just did crossed that line.